Hello, everyone, and welcome. I'm Dr. Ben Osevwe, and I'm excited to have you here for another focused clinical teaching session created especially for PMHNP students, psychiatric nurse practitioner residents, and future mental health prescribers. Today's topic is ASD or autism spectrum disorder. For more PMHNP clinical training, mentorship, and clinical rotation support, call 832-991-6516 or subscribe at rotationmatchnetwork.com. Let's get started. What is ASD? Autism spectrum disorder is a neurodevelopmental condition. That means it starts during brain development and affects how a person communicates, connects socially, learns, behaves, and processes the world. The CDC describes ASD as a developmental disability caused by differences in the brain, often involving challenges with social communication, social interaction, and restricted or repetitive behaviors or interest. A simple way to explain ASD is this. The autistic brain may process information, sounds, emotions, body language, routines, and social cues differently. ASD is called a spectrum because it looks different from person to person. Some patients need major daily support, while others communicate well, but still struggle with sensory overload, social stress, anxiety, routines, or emotional regulation. Clinical Pearl. ASD is not a behavior problem. It is a difference in brain development and brain processing. Common signs and symptoms. Common signs and symptoms may include difficulty with back and forth conversation, limited eye contact or different use of eye contact, difficulty reading facial expressions, tone, or body language, preference for routines and predictability, strong distress with changes, restricted or intense interests, repetitive movements such as hand flapping, rocking, pacing, or spinning objects, sensory sensitivity to sounds, lights, textures, smells, clothing, or food, difficulty making or keeping friendships, meltdowns when overwhelmed, delayed speech in some children, or advanced vocabulary with social communication difficulty in others. The CDC also notes that people with ASD may have different ways of learning, moving, or paying attention. Clinical Pearl. Do not assume ASD always looks like poor eye contact or no speech. Some autistic patients mask their symptoms very well, especially teens, adults, and females. Cellular, genetic, and neurobiological causes. ASD does not have one single cause. It is usually caused by a combination of genetic, brain-based, cellular, and environmental factors. At the cellular level, ASD may involve differences in how brain cells communicate, form connections, and process signals. This includes differences in synapses, which are the tiny connection points where brain cells send messages. At the neurochemical level, systems involving glutamate, GABA, serotonin, dopamine, oxytocin, and immune signaling may play a role. These systems affect learning, social connection, sensory processing, attention, and emotional regulation. At the brain network level, ASD may involve differences in connectivity. Some brain networks may be overconnected, while others may be underconnected. This can affect social communication, flexibility, sensory processing, and emotional control. At the genetic level, genes can influence brain development, synapse formation, and communication between neurons. The CDC notes that some people with ASD have known genetic differences, although many causes are still not fully known. Clinical Pearl. Genes can increase vulnerability, but ASD is not caused by poor parenting. Psychosocial factors and daily triggers. Psychosocial factors do not cause ASD directly, but they can strongly affect how symptoms show up. Common triggers may include bullying, social rejection, school stress, family stress, sleep problems, sensory overload, change in routine, communication frustration, trauma, lack of support, unrecognized learning needs. A patient with ASD may become anxious, irritable, withdrawn, aggressive, or dysregulated when the environment overwhelms their nervous system. Clinical Pearl. When an autistic patient has a behavioral outburst, ask, what overwhelmed the nervous system? Not just, why are they acting out? Overlap with other disorders. ASD often overlaps with other psychiatric and developmental conditions. It can overlap with ADHD, where the patient may have inattention, impulsivity, hyperactivity, poor organization, or emotional reactivity. It can overlap with anxiety, especially social anxiety, separation anxiety, generalized anxiety, panic symptoms, and distress around uncertainty. It can overlap with depression, especially when the patient experiences loneliness, rejection, masking exhaustion, bullying, or chronic stress. It can overlap with OCD, especially repetitive thoughts and behaviors. Although ASD routines are often about predictability and comfort, while OCD compulsions are usually driven by fear. It can overlap with intellectual disability, language disorders, learning disorders, sleep disorders, tic disorders, trauma, and sensory processing challenges. NIMH notes that ASD symptoms in adults can overlap with mental disorders, such as anxiety disorder or ADHD, which can make diagnosis more complex. Clinical Pearl. Do not stop at the autism diagnosis. Assess the full picture: sleep, anxiety, ADHD, depression, trauma, learning needs, safety, and functioning. Medication options. Medication does not cure autism or directly teach social communication skills. However, medication may help treat symptoms or co-occurring conditions that interfere with daily functioning. Medication categories may include atypical antipsychotics such as risperidone or aripiprazole for severe irritability, aggression, or self-injurious behavior. Stimulants such as methylphenidate or amphetamine-based medications when ADHD symptoms are present. Non-stimulants such as atomoxetine, guanfacine, clonidine, or viloxazine when ADHD symptoms, impulsivity, hyperactivity, or sleep-related hyperarousal are concerns. SSRIs such as fluoxetine, sertraline, or escitalopram when anxiety or depression is present. Sleep medications or supports such as melatonin when sleep problems are significant and behavioral sleep strategies are not enough. The CDC emphasizes that ASD treatments are usually individualized and aim to reduce symptoms that interfere with daily functioning and quality of life. Clinical Pearl. Treat the target symptom, not just the diagnosis. Ask, are we treating aggression, anxiety, ADHD, depression, sleep, or irritability? Vitamins and supplements. Vitamins and supplements do not cure ASD, but they may support overall health when there is a deficiency or clinical need. Common supportive options may include vitamin D, vitamin B12, folate, or L-methylfolate when clinically indicated, omega-3 fatty acids for brain health, magnesium for sleep or tension, melatonin for sleep onset problems. Some patients may have highly restricted diets, so nutrition assessment can be important. Clinical Pearl. Always ask about supplements. Families should consult the patient's physician or psychiatric provider before starting vitamins or supplements, especially in children, pregnancy, seizure disorders, liver or kidney disease, or when taking medications. Let's summarize. ASD is a neurodevelopmental condition involving differences in communication, social interaction, flexibility, sensory processing, learning, and behavior. It may involve genetic, cellular, neurochemical, brain network, and psychosocial factors. It can overlap with ADHD, anxiety, depression, OCD, sleep disorders, language disorders, learning disorders, trauma, and sensory challenges. Medication may help with target symptoms, and vitamins or supplements may help when clinically indicated, but treatment should always be individualized. I'm Dr. Ben Osevwe. For more PMHNP clinical training, mentorship, and clinical rotation support, call 832-991-6516 or subscribe at rotationmatchnetwork.com.